Seeing blood clots in your menstruation. Nurse Merit, is this normal? Should I be scared? This person is asking, what about somebody seeing meat, something that looks like meat in your menses? Now, I'm going to be talking about in this video menstruation clots and what it entails and what you should do. Now, menstruation clots are not supposed to be something you see frequently when you see your menstruation, okay? And also, they are not supposed to be more than the size of a grape. It has to be very small. Anything that is more than the size of a grape, which is supposed to be small or smaller, then there may be an underlying condition. Okay, so now look at how this menstruation clot happens. I would like to explain better so that you understand. Normally, when you are about to have your period, normally before you have your period, that means that you did not ovulate. That means that you did not get pregnant. So because you did not get pregnant, the supposed egg shed out as blood. That's shed off the endometrial layer as a form of menstruation. Now, when this menstruation comes out, which is a part of your endometrial layer, it comes out through the cervix. Okay, now because of the time it takes, when it gets through the cervix, then you can now see it as in your pad. But sometimes when it gets through the cervix, because it's pulling first in the cervix, there's a little bit of clot in it, okay, forms clots. But as it's forming clots, your body has a way of producing something that will dissolve the clot. But there are some conditions now that will make the blood to be to be so excess, thereby the way your body produces that thing that dissolves the clot is slowed out, so the blood comes out exceeding the way your body works. So these conditions are conditions like fibroids. Fibroids may block some of the places, making it probably delay the way your blood is coming out, or makes bleeding faster. The next thing that can cause this is endometriosis, which we'll be discussing about fibroid on our next video, or just expect that video. I think I have it also on my YouTube channel. The next thing that can cause this is endometriosis, where endometrial cells grows out of your uterine walls, grows in other different parts of your uterus. So this endometriosis can make you have a lot of cramps. This is why I've always told us not to ignore serious cramps. You have to see the doctor if you're having serious cramps. Okay, this is going to make you bleed more, and as you bleed more, the clotting factor that your body produces is not enough, so making you see more bigger clots. Okay. The next thing that can cause this is adenomyosis. Okay, this is when the uterine line grows in the uterine wall, so making the uterine lining thicker. So this makes you bleed heavy, makes you bleed more. Okay, so the next thing that can cause this is hormonal imbalance, which is one of the reasons why we may have miss their period, some period lasting for 2 weeks, 1 month, some period not coming for 1 month, 2 months, 3 months. I have made a video about hormonal imbalance and how to correct hormonal imbalance. Please make sure you watch that video here on my YouTube channel. And also missed period. Why? Because there are sometimes you miss your period where it is not a problem. Okay, there are times that it's a problem, and what you need to do to bring your period back. I have those videos here. Please make sure you locate them and you watch them. Please, I forgot to mention that my name is Nurse Merit. If this is your first time in this channel, make sure you subscribe and click on the notification button. If you want to have a consultation with me, click on the link on my bio, or you can simply drop your question in the comment section. I will get to them when I'm less busy. Now, the next thing that can cause this is cancer. Okay, cancer can cause this. This is where it will now make you either bleed so heavily, or you don't even see your period at all. So cervical cancer, ovarian cancer, endometrial cancer can cause this. And one of the reasons why cancer occurs is endometrial cancer is if you've not been seeing your period. One of the reasons, I don't say this is the only reason. For instance, those women that don't see their period for months, for years, they are not yet menopausal women, please, this is not supposed to be so. When you've noticed you've not seen your period for how many months, please, once it is up to a month, please go to see a doctor. Please don't just sit down and keep quiet. This is very important. Okay, the next possible one is miscarriages. Okay, probably you may have had miscarriage and you were not aware, so you probably had a miscarriage. This is where, when it happens, you see blood clots. That's when your baby didn't come to term, your baby miscarried. Okay, termination of a baby when you don't want to, in a layman's language. So when you have seeing clots is another sign that you probably had a miscarriage. Okay, so you may now see bigger clots. And I forgot to mention, in the case of endometriosis, that when you, because of the uterine cells are growing abnormally, you may bleed so much, and because of the bleeding so much, the blood is pulling in, and then you have blood clots. So this is why seeing blood clots frequently in your period is what you need to be careful. Okay, now the next one is a procedure, is a situation, a condition where blood, the factors, you're having a deficiency of the factors that clots your blood easily. Okay, this is a condition called von Willebrand disease. So how you may know that you may have this condition, probably if you find out that any little thing you bleed or you bruise easily, your teeth are bleeding. If you have just a minor injury, you bleed, and sometimes your bleeding is excessive for a small wound that would have happened to you that is supposed to have stopped bleeding, it's still bleeding. If you've noticed any of these, please make sure you see a doctor. So because of that, you tend to bleed more during your menses, and then the clotting factors are not there, so it's a condition. It's sometimes it's inherited. Okay, now, having known about this, we're going to talk about factors, this thing that will help you stop bleeding, or the choices that your doctor, what will happen, how to stop this from happening, what your doctor will do in order to help this. What are you going to do when you notice this these things clotting, when your clot is more than, how I explain, more than a grape seed, and also it is continuous. Like I said, it's not something that you're supposed to see every time your period. You may be seeing clots, I mean, sometimes, but every time you're seeing clots and the clot is so big, so big, so big, this is not normal. You may be having any or two or three of these conditions I mentioned, and this is not ideal. Okay, so please listen attentively. So let me also mention that treating this bleeding heavily or having clots depends on what is going on with you. Okay, depend on the condition that your doctor finds out that is the factor that is going on with you. For instance, if you're having fibroids, your doctor may prescribe hormonal method, which example of it could be progestin, IUD. Okay, IUD, where it's inserted through your cervix and then is releasing progestin gradually. So once this is done, it will make you have fewer periods. Okay, your period will be fewer, and the bleeding will be reduced, thereby your clots also not going to be so much, or probably absent. Next option that your doctor use is birth control pills, which will reduce your clots by 50%, and even your blood flow if you're having heavy period, which can also be caused by the fibroids. Okay, your doctor may choose birth control pills or the IUD. It's all dependent on the one. The next one on the list is treating the problem. If you're having hormonal, if you're having the bleeding issues, okay, the bleeding issues where I mentioned that you bleed because your blood, the clotting factors are not there, which I explained to you, examples of you're bleeding easily, your teeth is bleeding, your gums is bleeding, any little thing, your bruise. Okay, if you have this condition, it's going to make you to bleed heavily and have blood clots. Okay, so the treatment of this is, when you go to your doctor will have to, run tests, platelet tests, and find out if you have this condition, and then fix it. If you're having the clotting factors are not available, or you don't have your platelet counts are low, the doctor will either give you fix this, they know what to do. Okay, now the next one is finding the solution to the problem, or removing the obstacle that is causing this bleeding. For instance, in the case of fibroid, your doctor may decide to remove the fibroid tissues, okay, to help stop this continuous bleeding. Most doctors may try to give you the pills, like I said, or the IUD, but it all depends on the type of your fibroid. We're going to be talking about fibroid on our next video, and the treatment of fibroid, the ones that, of course, surgically you may want. What are the things? Most people are having fibroid and it keeps growing. They are doing some things on a daily that keeps this fibroid to continue to grow. We're going to be talking about fibroids on our next video. So the next option for home remedies is, make sure you take lots of water, take foods that are high in vitamin A, vitamin B, and vitamin C and D. Okay, so these are antioxidants. Some of them are filled with a lot of vitamin B3, help reduce the prostaglandin that causes you to have more pains. Okay, you can get these vitamins in your food, or you can take them supplementally. Please make sure you see your doctor before you take, or ask your doctor before you take any supplements, in case you are contraindicated to take any supplements. Okay, and you may use ice pack, put an ice in the cloth, and put it on your abdomen towards your cervical, your cervix area, your stomach, down there, before this happens, before you're on your period. Okay, before you start noticing clots. Okay, the last option is hysterectomy, which is the last option, where your doctor finds out that there are some other things that are causing these, that are not an underlying condition that is not acceptable, that will put you in danger, where the doctor removes the uterus. Okay, and this is usually done if there is no other alternative, probably nothing else is done. So remember, if you are soaking, your pad is soaking more than as it should, you should see the doctor. If you're bleeding heavily, you should see the doctor. If you're having period pains that makes you not to go on with your normal daily activities, you should see the doctor. So let me know if you have more questions, and put them in the comment section. Have a nice day.